Hi, so you just received the diagnosis of epilepsy and seizures, and I'm sure that you're worried and you have so many questions that you would like to answer and get some closing on. And today I will sit down with you and discuss one-on-one and answer all of your questions about epilepsy and seizures. What are the causes of epilepsy? What is epilepsy? How we treat it? What are the testing that we need to do? Is epilepsy treatable? How long we need to treat epilepsy? And can we drive? What about alcohol? Can I get married? And all of those many questions in your mind. So I am Dr. Omar Danoun. I'm a neurologist specialized in the treatment of epilepsy, especially the complex cases. And this video will be long, but will be comprehensive and worth your time here. And I wish that every patient will get the chance to listen to all of those counseling and answers right at the first visit when I see them and others see them. So let's start. What is epilepsy? So epilepsy is a condition when the brain has excess electricity and causes spontaneous seizures. So the way we diagnose epilepsy is that you have spontaneous seizures, means that these seizures happen without any external or any other causes. And the seizures can be 2 seizures or more that happens more than 24 hours apart. So this is the first type we can diagnose epilepsy. The second diagnosis of epilepsy is that if you have only 1 seizure, however, when we do testing with EEG, brain MRI, and other testing, we find things that tells us that you can have high risk of seizure coming back, and we can make the diagnosis of epilepsy. And the third diagnosis of epilepsy can be made if we have epilepsy syndrome that is clear and distinct diagnosis. So what types of epilepsy there are? We have 2 major types of epilepsy. One of them is called focal epilepsy. Focal epilepsy is that when the seizures and electricity happen in one side of the brain or one spot in the brain, and then usually it sparks electricity and then spread to that area or all over the brain. And this type of epilepsy can be treated with any seizure medications. And the other types of epilepsy is called generalized epilepsy. And generalized epilepsy is a condition when the excess electricity comes from all over the brain. Usually the cause of this epilepsy is genetic, means that there is a gene that is defected and it is controlling the electricity of the brain and makes the brain a little bit more excitable and more irritable and causing spontaneous seizure. It is very important to differentiate between those 2 types of epilepsy because the treatment can be different, and sometimes some generalized epilepsy can get worse if you treat them with the wrong medication. Even mid-seizure medicine can make the generalized epilepsy a little worse if you don't pick up on that diagnosis. And then what is the cause of epilepsy? Well, causes of epilepsy can be variable, and it can be as categories. Genetic causes means that there is a gene defect in the brain that causes abnormal electricity and leads to seizures. It can be metabolic, means that there is a problem in the metabolism of the brain, such as like mitochondrial problems, or there is glucose deficiency or any other metabolism issues that either lacking of compounds that are important for the brain, or there is accumulation of toxins that disturb the brain function, and that leads to seizures. And there is immune etiologies. Immune etiologies means that there is inflammation or the immune system attacks the brain and can cause seizures. It can be a part of the autoimmune condition, or it can be there is a cancer in the body that triggers the immune system to fight the cancer and then fights the brain as a consequence of that. And this needs to be treated with immune treatment as well. And the other one is structural etiology, means that there is a problem in the structure, either congenital, means that it was during the brain development, and we call them brain birthmarks, such as cortical dysplasia or heterotropia, when the cells do not form right or do not move in the correct manner, or acquired, means that you get that either due to a stroke, brain tumor, abscess, infection, or anything. And other cause is infectious, when there is an infection in the brain that causes seizures as an acute symptom during the infection, or it can lead to scars that can cause epilepsy down the line. And actually globally, the most common cause of epilepsy is infections such as HIV, neurocysticercosis, malaria, and other causes of infection. And sometimes we do not know the exact cause, and all the testing will be normal. And the cause of epilepsy can vary from age group to another. In the first 6 years of life, the most common cause of epilepsy is genetic. Usually, like all those gene problems and gene syndrome, they will present early in life. It can be due to birth trauma or lack of oxygen to the brain. and then there will be a steady state of epilepsy throughout the life, and then there will be a huge peak at the end of life after 65 years old, and most of those cases are either caused by acquired symptoms such as stroke, brain tumor, traumatic brain injury, and neurodegenerative conditions such as Alzheimer's disease and dementia. Alright, so how can we test for epilepsy? Well, when we test for epilepsy, the mainstay of testing are, first we do brain MRI, which is taking high quality pictures of your brain, and not all brain MRIs are the same. For epilepsy, we have high quality epilepsy specific MRI sequences that we can do to really take an excellent look at the brain structures that sometimes can be seen only in those high quality scans. And also it has to be read by an experienced neuroradiologist that can take a look at the brain, and their eyes are very trained very well for detecting those abnormalities. The other test is EEG. EEG is a brainwave test that we put wires in the head to detect the electricity activity of the brain, and we can see in the brain abnormal electricity that can be focal seizures or focal discharges. They call them spikes or discharges in one side of the brain, or it can be all over the brain. It's called generalized discharges, and those are important to tell what type of epilepsy you have, focal or generalized. And other testing, we can do lab work. So lab works are important to do liver, kidney, blood, all of those testing to get a baseline, because we're starting medication and those can be needing monitoring, and also to get a good idea about the health of the patient. And sometimes if we're suspecting some type of epilepsy syndrome or some genetic cause, we can test for those genes. Now let's talk about the treatment of epilepsy. How can we treat epilepsy and seizures? The mainstay of treatment is medications, and it is very important to take your medications regularly on time every day without missing any dose, because missing seizure medications can be a little dangerous, because sometimes missing one medicine and one dose can lead to seizure. How we can choose the best medicine for you? There is no one size fits all in the treatment of epilepsy. Not all medications work for all patients, and we should think of the patient background before choosing the best medicine for them. For example, if somebody has psychiatric problems, means anxiety, depression, PTSD, if you put them in the medicine Keppra, levetiracetam, that can make those conditions worse. Instead, we put them in a medicine that can treat anxiety, depression, and PTSD, such as lamotrigine or lamictal or valproic acid or Depakote. If we have a woman of childbearing age, we put them on the medicine that is safe in pregnancy, such as levetiracetam or Keppra and lamotrigine. So it is important to put in mind the patient background for the best treatment. And then how long we need to treat epilepsy? Well, epilepsy is a chronic condition of the brain, which means it's not like an infection that you have a throat infection with strep throat, you take antibiotics, you kill the bug and the bacteria, and that's it. So 10 days and this is the end. No, in epilepsy, the treatment is long-term, and usually our goal is to get the best medicine to treat the seizures and have good seizure control and be very well tolerated and safe on the long term. Treatment of epilepsy takes years. It's not like 1 day or 1 year or 2 years. It takes years to come, and sometimes, and even the majority of people will need lifelong treatment, especially if the seizure started in adult life and if we had hard time controlling the seizures at the beginning. And it's always a discussion with the treating doctor of how long the treatment should be. And now, what can you do to prevent seizures from happening and avoid the triggers? So seizures can be triggered by multiple things. First of all, it can be triggered by lack of sleep. So very important to get enough 8 hours of sleep, that you can be rested and have the brain relax at night and kind of cleans everything up. And the other thing is that avoid stress, avoid not taking your medications, because missing medications can lead to seizures. And then any specific triggers for your seizures. Some people will have some food that can trigger the seizures, some strobe light or flashing of light or any clear triggers, or sometimes the period can be changed and cause seizures. And then alcohol and epilepsy. Can I drink alcohol if I have epilepsy? Well, in general, excessive amounts of alcohol can trigger seizures when you consume alcohol, and the withdrawal from alcohol can cause seizures. And lots of times the alcohol can interact with the anti-seizure medications that you take. In general, I advise my patients to stay away from alcohol so that they don't get seizures worsening. And there are some types of epilepsy that are very, very sensitive to alcohol, such as juvenile myoclonic epilepsy. When kids drink alcohol, they have seizures right away. And then the question about driving. Can I drive when I have epilepsy? Well, here's the thing. When you have epilepsy, you can have seizures that impair your consciousness and you will not be able to control the car, and that will lead to accidents, God forbid. So here's the thing. In general, when you have seizures, you should not drive. How long you should not drive can vary from one area of the world to another based on the local laws. In general, 3 months to 6 months to 9 months is the law in most of the states in the United States and in the countries of the world. And so make sure to know the area that you live in and what are the rules and regulations. And those rules are not done by the government or the authorities. It is the brain rule. The brain will have seizures after having this seizure this time. It will likely have seizures after the coming 3 to 6 months. So it is very important to avoid driving and not drive at all if you are having seizures that are not controlled. After 6 months or 9 months without any seizures, yes, you can go back to driving if your doctor decided so. All right, let's talk a little bit about safety and epilepsy. Epilepsy can lead to injuries, drowning, death even. So we should know the important tips about safety. For example, you can fall and injure yourself, so you should avoid climbing ladders, climbing heights and roofs and all of that. You should avoid operating heavy machinery if you are having uncontrolled seizures. You should avoid driving as well. Also, if you have uncontrolled seizures, you should not take a tub and bath. You should take a shower while standing. And you should familiarize yourself and the people around you with the first aid for seizures. So how can you help somebody with seizures? The most important thing is that safety means that take anything that is sharp they can hit themselves on, such as a table or a corner or anything. Do not attempt to open their mouth or put anything in their mouth or stop them from having the seizures, because that will lead to more injuries. And once the seizure finishes, put them in the safety position with their head down, so that if they vomit, will go outside. There is nothing called tongue swallow in epilepsy. It is a myth. And we have now handy medications that you can have on you that will stop the seizures if it goes on for a long time, such as nasal medications, rectal medications, or medications that you are put under the tongue. So those medications are very important. You give those rescue medications when the seizures go for 5 minutes and longer, or if you have 2 back-to-back seizures without regaining consciousness, that means that the seizure is still cooking under the brain. All right, let's talk about a little bit about the women's issue with epilepsy. So birth control. It is advised for people with epilepsy to be on birth control and have a reliable birth control methods. For example, seizure medications can interact with the birth control containing estrogen. Sometimes the seizure medications will decrease the birth control efficacy, and the birth control medications can decrease the levels of some seizure medications such as lamotrigine. So it is important to discuss with your neurologist and OBGYN doctor about the best birth control for you. And then going into pregnancy, we should always prepare for pregnancy ahead of time by taking folic acid for any woman of childbearing age. And then most of the anti-seizure medications are safe in pregnancy, and some medications are not safe, such as topiramate and valproic acid. Those are not safe in pregnancy, and we try to avoid them in any women of childbearing age. And then during pregnancy, you should continue taking all of your seizure medications on time, and then you and your doctor will likely increase the seizure medications with time, because during pregnancy, the body will start filtering medications much faster, and we need to increase the dose to keep up with that. And then at the time of delivery, we should deliver normally, because there is no indication for cesarean section unless there is an obstetric indication for that. And then after the delivery, we decrease the medication slowly to go back to the normal, because the body goes back to the normal physiology. And then after delivery comes the breastfeeding. In general, most of the medications for seizures are safe for breastfeeding, and it is very encouraged to breastfeed your baby because of lots of important benefits, such as increasing IQ and lots of benefit on the baby. So you should definitely breastfeed. However, the first few weeks after delivery can be very stressful and can induce seizures. So you should talk to your spouse and family to help you with the baby, so that you can get a good night's sleep and they can wake up and help the baby and feed them in the night. And you can express breast milk and save it in the night, and they can feed the baby so that you can get good sleep. Because if you have fragmented sleep and you keep waking up, that can induce seizures. And then comes the issue of SUDEP. SUDEP is a little sensitive topic, means sudden unexpected death in epilepsy patient. This condition that people with epilepsy, they can have a big seizure and then die because of that, or even die without any clear explanation. And I would like to talk about this subject because I don't want you to go over the internet and start reading about epilepsy and stumble on this SUDEP and have lots of questions and get scared. So here's the thing. Families who had SUDEP in their loved ones, they wish that they knew about this condition before. But I would like to reassure you that SUDEP happens only in 1 in 1,000 people with epilepsy, and usually happens in people who have uncontrolled seizures. So the best thing to do to prevent SUDEP from happening is to control the seizures best, continue taking your medications daily, and that will be good to prevent seizures from causing any of those complications. And if you have very difficult to control seizures, you make sure to see the epilepsy doctor who is specialized in seizures and epilepsy to control the seizures better by doing other treatments such as the surgical treatment and whatsoever. And then comes the follow-up. So it is very, very important. We're starting on medications for your seizures, and then you might have side effects on medications, or you might have some changes. Might seizures be controlled or not? All of those things should be discussed with your neurologist and follow up with them very closely, and make sure that you continue following up with your neurologist to get the best result possible after the treatment of your seizures. So this was a big tour about seizures and epilepsy treatments, and I have on this channel lots and lots of videos that can be of help to you. And to help you more, I put the best 10 tips for treatment of epilepsy that you can explore in this video. And stay healthy, and see you in the next one. Salam.